In this video, we'll demonstrate the proper technique for scapular PNF. As you perform the technique, keep in mind for these key components. Both your manual contacts and verbal cues should be designed to elicit the desired diagonal movement. Be sure to watch your body mechanics and use an appropriate amount of resistance for your patient. For scapular PNF, your patient should be positioned inside lying with the involved side up, the head, spine in neutral, and the hips and knees flexed. There are 4 distinct directions of movement for the scapula: anterior elevation, posterior elevation, anterior depression, and posterior depression. We can use our clock face as a reference. Please note that your clock reference points will change depending on whether the patient is being treated for the right or left side. For anterior elevation and posterior depression, we're moving towards the nose and the back pocket respectively. For posterior elevation and anterior depression, we're moving towards the back of the head and the front pocket. Let's take a closer look at these individually. For posterior elevation of the scapula, our primary muscles being targeted are the trapezius and levator scapula. The patient will be moving the scapula towards the back of the head, which is a combination of elevation and adduction. For posterior elevation, the manual contact should be on the upper trapezius above the spine of the scapula. If needed, the hands can be overlapped to avoid providing confusing manual cues. The clinician's arms and body should be lined parallel with the direction of movement. Verbal cueing should facilitate adduction and elevation of the scapula. It's important to make sure motion only occurs at the scapula and that the patient does not begin to rotate the trunk.
Press up into my hand. 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 One more time. Press up into my hand. Good.
The primary muscles being worked during anterior depression include the rhomboids, serratus anterior, and both the pectoralis major and minor. The scapula will be moving into depression and abduction or down towards the ASIS. For anterior depression, one of the hands will be on the posterior axillary border of the scapula, while the other hand's on the anterior axillary border on the pectoralis major. Again, the therapist's fingers, hands, and body should be aligned in the direction of movement. Sample verbal commands include pull your shoulder blade towards your belly button or pull your shoulder blade down and forward. Make sure that motion only occurs through the scapula and not through the trunk.
Pull your shoulder down towards your belly button. Pull your shoulder down towards your belly button. Pull your shoulder down towards your belly button and relax.
The primary muscles involved for anterior elevation include the rhomboids, levator scapula, and serratus anterior. For anterior elevation, the scapula will be moving towards the nose into an elevated and abducted position. To provide manual cues, one hand is placed over the anterior aspect of the glenohumeral joint and acromion, and the other hand rests on top of the first. The clinician should be aligned along the direction of movement. Verbal command should help guide the scapula anteriorly and superiorly.
Up and forward into my hands. Up into my hands. Up into my hands. Good.
Finally, for posterior depression, the muscles involved include the serratus anterior, rhomboids, and latissimus dorsi. For this pattern, the scapula will be moving into depression and adduction, or down towards the back pocket. Manual contact should happen through the heel of the hands and should be placed along the inferior medial border of the scapula. It's important to make sure that your fingers are aligned with the acromion and below the spine of the scapula. Resistance is provided to facilitate the proper direction of movement. Verbal command should direct the scapula into depression and adduction.
Press down into my hand. Press down into my hand. Press down into my hands. One more time. Press down into my hands.
So to summarize, this video covered how to perform PNF for anterior elevation, posterior elevation, anterior depression, and posterior depression of the scapula.